Hi everybody, my name is Anish, and today we're going to talk about elbow lateral epicondylitis. And that's just a fancy word for saying pain on the outside part of the elbow. And you might have heard it also being called as tennis elbow because it was thought that this is commonly due to people that play a lot of tennis because they extend their arm a lot. Now, we're going to explain this video in 4 parts, okay? So the first part is going to be for anatomy of the elbow, which will be just a brief overview. Then we're going to talk about the pathophysiology, which is what exactly is going on, that's causing this lateral epicondylitis. And then we're going to talk about the history, and this is where it's most important for you guys, because that's where you're going to be coming in and trying to see what signs are pointing towards this disease. And then finally, we'll talk about the treatment and how we would approach that. So let's go ahead and get started, okay? So here you'll see 2 pictures of the elbow. And let's start off with the picture on the left. So there are 2 main bones of the elbow. The first is the ulna, all right? And that sits right over the pinky bone over here. And then you have the radius, which is the other bone, and that sits over the thumb. And there's a number of muscles, but the one that we're most concerned about is the one that's involved in lateral epicondylitis, which is external carpi radialis brevis. Extensor carpi radialis brevis. And that's ECRB for short. Now what happens, and we'll move to the picture to the right, is on things like tennis and overuse and constant extension of your arm, you'll start getting little tears in the tendon of this muscle, the extensor carpi radialis brevis. And the tendon is a part of the muscle that connects it to the bone. So this is a zoomed in picture. And what you create is these little micro tears. Now the micro tears are what's going to be causing the patient pain. And most oftenly we will see this pain on extension of the elbow, which is when you have the patient flatten their arm, and extension of the hand, in which their hand is facing down, palm up. So, and when you have the patient extend their arm and extend their hand, then you'll often get this pain on the lateral side of the elbow, and that'll give you your diagnosis. So let's quickly talk about what you would go for on a history. What questions do you need to ask? Now the way I like to remember this is old cards, which is onset, location, duration, characterization, aggravation, radiation, and temporal. So onset is when did this happen? L is for location, is where does it hurt? D is for duration. When you do get the pain, how long does it hurt? And then C is characterization. Is it sharp? Is it numb? Is it tingly? If it's numb and tingly, it might mean it's involving a nerve, which might be a little bit more serious. Then you want to ask, what are the aggravating and the alleviating factors? So what makes it worse? What makes it better? So things like, oh, when I play tennis, it hurts. Or when I extend my arm a lot, it hurts. Or when I take ibuprofen, that seems to help it a lot. Then we have radiation. Where does the pain go to? Does it go all the way down the arm, or does it just stay in that area? T is temporal. When does the pain get worse at night? Does it get worse in the morning? Is it worse in the morning? It's important to find out these factors. And then S is severity. How bad is this? How bad is it impacting your life? On a scale of 1 to 10, 10 being the worst pain, where is it for you? So once you kind of have this clinical suspicion, then you want to start looking at the treatment options. So I know this looks a little complicated, but it's pretty straightforward. So think of this as steps, right? So this right here is the first step, then this is the second step, third step, and so forth. The first time the patient comes in, and the pain isn't too bad, and you're pretty sure it's lateral epicondylitis, you might want to consider just starting them off with over-the-counter meds, ice, and rest 2 times a week while avoiding wrist extension exercise. Now, the worse it gets, you might want to go up the step, or the ladder. The pain cream, and the oral medications, the cortisone injections. Let's say all of that doesn't work. Then you might even want to consider getting imaging, like an MRI, and that might show a tear or something that an orthosurgeon can go in and actually clean it all up and do their job. And that will hopefully be the most definitive treatment for the patient. So that's it. Hopefully that was helpful. See you at the next video.